When caring for a burn patient, remember that your priorities change as the patient moves through each phase of burn recovery. During the emergent phase, your goal is simple: save the patient's life before saving the skin. Use the mnemonic SAVE LIFE to remember your priorities. S stands for shock prevention. Massive fluid shifts can lead to hypovolemic burn shock. So begin aggressive fluid resuscitation and monitor for signs of poor perfusion. A stands for airway management. Always assess for inhalation injury. Patients with facial burns, hoarseness, soot around the mouth, or singed nasal hairs may need early intubation before airway swelling occurs. V reminds you to monitor vital signs and urine output. Urine output is one of the best indicators that fluid resuscitation is working. E stands for electrolyte balance. Burn patients are at risk for dangerous electrolyte abnormalities, especially potassium changes during the first several days after injury. L reminds you to establish large bore IV access so fluids can be administered rapidly. I stands for infection prevention. Cover the burn with clean, dry dressings and protect the wound until definitive treatment begins. F means perform a full assessment, including estimating the total body surface area burned using the rule of nines. Finally, E reminds us to provide emotional support to both the patient and the family during this stressful time. Once the patient is stabilized and fluid balance has been restored, they enter the acute phase, where the priority changes from saving life to healing the wound. Use the mnemonic HEAL. H stands for high protein, high calorie nutrition. Burn patients have extremely high metabolic demands and need extra calories and protein to rebuild damaged tissue. E stands for eliminate infection. Perform meticulous aseptic wound care and closely monitor for signs of infection or sepsis. A stands for assist with mobility. Early movement, splinting, and physical therapy help prevent contractures and preserve function. L reminds you to look for laboratory changes, including sodium, potassium, and white blood cell counts, which can indicate electrolyte imbalances or developing infection. Remember this simple NCLEX tip: emergent phase equals save life, acute phase equals heal the wound. If you remember those two priorities, you know exactly what comes first in caring for burn patients.